Hello, and welcome to a review of Synapticure's comprehensive approach to memory and brain care. I'm Eric Anderson, the Chief Medical Officer at Synapticure. I've spent more than a decade pioneering teleneurology and providing remote care to people with neurodegenerative diseases. It's my privilege to guide you through our virtual care model, share insights into our comprehensive methods and services, and to demonstrate how we're providing expert care and support for patients and caregivers alike. Synapticure offers fast access to expert care, personalized support, and seamless coordination, all in one place. Our care model is designed for flexibility, allowing healthcare professionals to tailor support to the specific needs of their patients. This adaptability is supported by our wraparound model, which is built on regular communication about our mutual patients, and our platform supports seamless integration with our referring partners' electronic health records, which ensures continuity and collaboration across the care spectrum. As symptoms progress, our co-management model adjusts accordingly to meet any evolving needs. Key services we offer revolve around rapid access and include a 24/7-hour hotline, behavioral and mental health support, speech therapy, subspecialty neurologists with advanced training, a multidisciplinary review board, advanced treatments and clinical trials, in-home services, and personal care navigation to reduce the stress for both patients and caregivers. With leadership from experts in dementia care, Synapticure's scalable infrastructure is designed for growth. Our clinical leadership team in the dementia space are all involved in research, as well as clinical care, allowing us to bridge the gaps between the lab bench and the bedside. Unlike a traditional hospital or clinic, we're able to bring these expertise, which are normally scattered across the country, to focus in a collaborative fashion on singular and personalized patient care. Our virtual platform brings everyone together to ensure quality care for all patients while maintaining the highest standards. Synapticure's workflow is designed to deliver seamless and effective care, ensuring patients and their families receive the support they need at every stage of their journey. Here's an overview of our process that we'll walk through in detail. Evaluation and diagnostics, treatment and clinical trial decision-making, supporting access to treatments, and safety and monitoring. Our workflow begins with personalized care coordination, which is the backbone of our clinical services. We ensure rapid access to virtual appointments and handle all logistics, which minimizes the stress and administrative burden for both our patients and their families. Our virtual appointments are designed to accommodate our patients. We understand that changing a person's environment can be disorienting, and so our virtual visits occur within the home, which also provides us with great insight into their current living conditions and potential home hazards. We operate across all time zones, which allows us to schedule visits outside of traditional office hours, which offers greater flexibility for individuals and families juggling busy schedules. Initial visits typically last between 60 and 90 minutes, allowing ample time for a thorough and personalized comprehensive assessment. This approach ensures that our specialists can listen carefully, understand the full scope of each patient's needs, and perform a comprehensive teleneurology assessment, as well as develop an individualized care plan. Our team includes subspecialty neurologists with advanced training in diagnosing and managing early cognitive impairment and other complex neurologic conditions. Our comprehensive evaluation is informed by the latest research and best practices and facilitates accurate diagnoses. We also recognize that leaving the comfort of a home to visit a doctor's office can be disorienting, especially for those with memory and cognitive issues. This disruption can often result in inaccurate assessments of a person's true abilities. By conducting evaluations virtually, patients remain in a familiar environment, allowing them to put their best foot forward and helping to produce more consistent and reliable results. In addition to thorough history taking, a review of prior imaging as well as labs, and a review of prior records, each patient undergoes a thorough teleneuro examination, which includes a mental status exam, cranial nerve exam, motor and sensory exam, and cerebellar exam. Many of these components are scored in the validated form of the NIH stroke scale, which forms the foundation of the teleneuro exam and is incorporated into every visit. This standardized tool helps establish a clear and reproducible baseline, which allows us to consistently monitor each patient's progress over time with great inter-rater reliability. At Synapticure, we understand that additional appointments and testing may be necessary. Our streamlined approach ensures these processes are fast, efficient, and patient-focused. One of the unique aspects of our care model is that all of the members of the care team are able to directly collaborate on every patient case, and their medical care is not siloed. Importantly, we prioritize timely access. Appointments are typically available within weeks, not months, so patients can quickly move forward with their care. We offer comprehensive support for imaging, treatment, and genetic testing to simplify the process for patients and caregivers. We have licensed genetic counselors in-house who are able to provide education and counseling regarding sensitive and difficult testing results. Our network navigators ensure that we're able to find the accredited facilities in each region that can meet our rigorous standards for imaging and pre- and post-infusion treatments. Our dedicated care coordinators manage every aspect of the process, including identifying locations, setting appointments, and much more. We've designed a decision-making process that is comprehensive, evidence-based, and tailored to the unique needs of every person that we serve. Synapticure's multidisciplinary review board is a hallmark of our approach that mirrors the processes found in leading academic centers. Our review board is comprised of 3 Synapticure cognitive neurologists with advanced expertise in neurodegenerative diseases, as well as 1 neuropsychologist who specializes in cognitive testing and assessments. This collaborative model ensures that important treatment decisions are not made in isolation. Instead, they are guided by a panel of experts who are versed in the latest research and best practices, providing patients and families with confidence and clarity about their care plan. Synapticure provides patients with access to newly approved treatments and cutting-edge clinical trials, offering opportunities for therapies that may not be widely available elsewhere. Our neurologists are deeply familiar with the eligibility criteria to determine which advanced treatments or clinical trials are most suitable for each individual patient, as well as the safety considerations to ensure that therapies are administered with the utmost care and monitoring. They're also versed in the therapeutic outcomes and leverage their expertise to guide patients towards the best treatment for their personal situation. Synapticure only partners with infusion centers that meet the highest accreditation standards. These centers are typically certified by organizations such as the National Infusion Center Association and the Joint Commission, both of which require adherence to strict protocols for pre-treatment evaluations to ensure patient readiness and safety, emergency response preparedness for any potential complications, and post-treatment care to monitor and support patient recovery. At Synapticure, we have established robust safety and monitoring protocols to ensure that every patient receives the highest level of care, especially in challenging or emergency situations. Validated safety and monitoring protocols are carefully developed based on clinical guidelines, medication prescribing information, and published medical literature. Our care team is always on call, ensuring that patients and caregivers can speak to an experienced member of the care team the moment they experience any unusual symptoms or have safety concerns. And that team is intimately involved in their care and can provide them with immediate support. If emergency care is required, our neurologists remain actively engaged, staying on the line as patients head to the emergency department. They provide real-time advice and actionable steps, ensuring patients and their families are supported throughout the process. Additionally, we ensure that emergency physicians have access to patient history, treatment records, a validated clinical baseline, and more. For patients undergoing infusion therapies, we implement rigorous safety measures. Accredited infusion centers follow detailed observation protocols to ensure patient safety during and after treatments. Our care coordinators stay involved to provide additional support when needed. Our MRI surveillance protocols and ARIA management strategies are integral components of our program. In the event that ARIA is identified in a patient, we take immediate action to prioritize patient safety for each specific incident, which may include an emergency department referral, the pausing of treatment, monthly MRI monitoring, and reassessment by the Multidisciplinary Review Board is required to determine if treatment may be resumed. Thank you for joining us today to learn more about Synapticure's care model. We are dedicated to improving the quality of life for patients and their families who are living with Alzheimer's and other neurodegenerative diseases.